health and its impact on older adults. My name is Otto Briest, and I would like to begin by welcoming our fellow nurses. I also want to take this opportunity to thank our contributors, Chastity Martin, Jen Haight, Sierra Vanua, and Isaac Ray. Without their assistance, this presentation would not be possible. Poor oral health's impact on the health of elderly patients has not been fully explored and is not normally associated with disease processes. As we will see in this presentation, poor oral health does have a profound impact on the overall health of our patients. By examining oral health, we can begin to address its impact on overall health. For our presentation, I would like to share with you the CDC's definition of oral health, as it is the most accurate and inclusive. The CDC defined oral health as the overall well-being of oral structures, including teeth, gums, the tongue, and lips, controlling processes of mastication and verbalization. It is essential in maintaining holistic management of idealistic bodily processes. Note how the CDC's definition of oral health included the reference to maintaining holistic management of idealistic bodily processes. For example, processes like smiling, speaking, and chewing. Bellender described the cause and effect of how poor oral health increases the risk of patient impairment physiologically, psychosocially, and cognitively, and these impairments then impeded oral intake, potentially causing malnutrition and weight loss. In just 12 years, our older adults will outnumber children in the population. The significance of this is that oral health will become increasingly more important to address in this demographic, given its known effect on risk factors known to affect the physiological, psychosocial, and cognitive function. As you can see on the slide before you, the oral structures include the teeth, the lips, the soft palate, the hard palate, and the uvula. Data supports the effect of poor oral health with a study in a Swedish nursing home showing that 42% of adults 65 years old or older had dental issues that affected their nutritional intake. That's nearly half of the adults in the facility at risk for malnutrition and weight loss. With lower income levels who are at an increased risk due to fewer dental exams, poor oral hygiene, smoking, and even increased sugar intake. A multinational study concluded that 17% of older adults were edentulous, increasing the risk of malnutrition, disability, frailty, and mortality. Oral health include decreased cognitive function, increase in chronic illnesses and health conditions, inadequate nutrition resulting in malnutrition, and poor quality of life. Researchers have been able to quantify risks related to tooth loss. Older adults with less than 20 teeth were found to have increased malnutrition, locomotion impairments, decreased ability to perform ADLs, and were 2.5 times more likely to have cardiovascular disease. Older adults with less than 10 teeth were noted to have greater incidences of poor cognition. As you can see on the current slide, decreased cognition and increased functional dependence can be the result of poor oral health. Poor oral health affecting functional dependence will cause an increase in need for assistance with locomotion and the patient's inability to complete their ADLs without assistance. Older adults, because of poor oral health, have decreased strength, balance, resulting in a greater risk for falls, reduced social interaction, and less desire to participate in leisure activities. Poor oral health has been shown to contribute to chronic disease processes like chronic kidney disease, for example, especially in older women, and has been shown to increase the risk of aspiration as well. The inverse of poor oral health, good oral hygiene, has benefits as well. A study has shown that people older than 85 with most of their teeth had a longer life expectancy and had more muscle mass than older people that were edentulous. Inadequate nutrition in older people with less than 20 teeth has also been shown to increase their risk of having an unhealthy BMI and have an unhealthy HEI, or health eating index. Older adults experiencing poor dentition resulting in malnutrition had increased risk of malnutrition, increases the risk of falls, frailty, depression, decreased functional capacity, and increased infection rates, elongated hospital admissions, increases mortality, the risk of mortality, and increases economic burdens. As we said earlier, older adults with malnutrition experienced frailty, which can lead to disability, morbidity, and mortality. Proper oral health can aid elderly in maintaining adequate nutrition, thereby reducing factors associated with frailty. As healthcare providers, we need to help patients with good oral hygiene. Although innovative solutions are needed to promote good oral hygiene, the CDC has recommendations that need to be followed. Basic care, if properly performed, can be an effective tool in preventing poor oral health. The CDC's recommendations include, but are not limited to, brushing the teeth twice daily. Use toothpaste that has fluoride in it. Drink water with fluoride. Flossing daily. Seeing a dentist at least annually. No use of tobacco products or alcohol. And for people with diabetes, keep the blood sugar at an appropriate level between 70 and 120. Nursing interventions include early screening, such as the mini nutritional assessment, which is extremely effective at determining a lack of intake and the BMI. Oral health education is an effective tool to educate patients on how to maintain oral health. Dietary management. Dietary management is an effective tool in helping the patient to understand how nutritional intake affect dentition. And nursing interventions can include close monitoring of low saliva and xerostomia. Has many impacts on overall health of older adults. As seen in this presentation, poor oral health contributes to chronic disease processes, frailty, increased morbidity, and mortality. It also contributes to diabetes, increased cardiovascular risk, and many other disease processes. Nurses can assess the oral health of patients and have a greater impact on the overall health and quality of life of their patients.